Welcome to the Rim Break Rodeo. We hope this video helps.
You have the prescription and the medication bottle. Check dose, frequency, and total days immediately. Once confirmed, take the first tablet with a small meal to reduce stomach upset and wash it down with water. Make sure to set an alarm or mark doses on a calendar so you don't miss the next dose. Do not drink alcohol now. It interacts and causes nausea and flushing. If you use other meds, pause to check interactions before continuing. Once dosing starts, keep a steady routine. Space doses evenly across waking hours and complete the full course, even if you feel better. If nausea appears, take tablets with a small snack or with meals, but do not crush or alter tablets unless your clinician permits. Monitor common effects like a metallic taste, mild stomach upset, or headache. Note their timing and intensity. Make sure to communicate any worsening or finish every dose until the prescribed course is complete. Stopping early can allow infection to return. After the last tablet, continue to avoid alcohol for 48 hours to prevent a disulfiram-like reaction. Once done, review symptoms. If the infection hasn't improved within the expected window, call your provider for reassessment. Troubleshooting tip: if you develop severe symptoms such as rash, numbness, or persistent bloody stools, stop the drug and seek immediate medical attention. These warrant urgent evaluation.
Thanks for watching. Consider subscribing if we helped you.